Hi, good day. Let me give you a better idea on what to expect during your comprehensive exam. Our goal is to help you understand the importance of dental exam and help you be prepared for your upcoming visit. We will run through some of the basic key points we usually check and show you how they affect your overall dental health. Meet our dentist. Dr. Liao's love for dentistry and commitment to patients' oral health is the baseline of our dental office. She knows every patient by memory, even the ones from when she started practicing. Let's go ahead and start with the type of x-rays we usually take and why they are an important tool for your dental examination. First on our list is panoramic x-rays. Panoramic radiographs are very useful for detecting impacted teeth, which are teeth that are blocked from emerging fully from the gums. These teeth can cause pain, discomfort, and even infection if left untreated. A panoramic x-ray can provide a clear view of the position and orientation of impacted teeth, making it easier for a dentist to plan and perform the appropriate treatment. Cysts are fluid-filled sacs that can develop in the jawbone, often as a result of an infection or trauma. They can be difficult to detect with a visual exam alone, but a panoramic X-ray can show the size and location of a cyst, as well as any associated bone loss or other changes in the jawbone. Panoramic radiographs can also help identify tumors in the mouth or jaw. These may be benign or malignant, but early detection is key to successful treatment. A panoramic X-ray can show any abnormal growth or changes in the bone structure that could indicate the presence of a tumor. The temporomandibular joint, or TMJ, is the joint that connects the jawbone to the skull. Problems with this joint can cause pain, clicking, and difficulty opening the mouth fully. A panoramic X-ray can show the position and movement of the TMJ, as well as any signs of arthritis or other joint disorders. Finally, panoramic radiographs can help identify any other abnormalities in the mouth or jaw. This may include extra or missing teeth, bone spurs, or other structural issues that could affect dental health and function. Another type of X-ray we take during your exam is an FMX, or full mouth X-ray. Full mouth X-rays can reveal areas of decay between teeth or below existing fillings that may not be visible during a visual exam. This allows dentists to identify and treat cavities before they worsen and cause more serious problems. Full mouth X-rays can also show the density and structure of the jawbone. Changes in bone density or irregularities in bone structure can indicate underlying problems such as periodontal disease or osteoporosis. Full mouth X-rays can help detect infections in the teeth or surrounding tissues that may not be visible from the surface. This is especially important for identifying infections that may have spread to other parts of the mouth or body. Full mouth X-rays can provide a clear view of the position and orientation of teeth. This is especially important for planning orthodontic treatment or for identifying problems such as impacted teeth. Full mouth X-rays can help diagnose disorders of the TMJ, which can cause pain, clicking, and other symptoms. It also provides a comprehensive view of the teeth and surrounding structures, allowing dentists to assess overall dental health and identify potential problems before they become more serious. On our next slides, I will show you some of the key points we check during your oral examination. When teeth and gums are healthy, the gums are pink, firm, and fit snugly around the teeth. There is little to no bleeding when brushing or flossing. Gingivitis is the earliest stage of gum disease and is caused by bacterial buildup around the gum line. In this stage, the gums may appear red, swollen, and tender. Gums may bleed easily, particularly during brushing or flossing. Gingivitis is typically reversible with proper oral hygiene and regular dental cleanings. If left untreated, gingivitis can progress to periodontitis. In this stage, the gums pull away from the teeth, creating pockets that can become infected. The body's immune system responds by attacking the bacteria, which can cause damage to the bone and connective tissues that support the teeth. Gums may recede, teeth may become loose, and there may be changes in the bite or the fit of dentures. Advanced periodontitis is the most severe form of gum disease. In this stage, the bone and connective tissues that support the teeth are severely damaged. Teeth may shift or become loose, and there may be changes in the bite or the fit of dentures. Advanced periodontitis can lead to tooth loss if not treated promptly. Dental calculus, also known as tartar, is a hard yellowish deposit that can build up on teeth and below the gum line. In its early stages, dental calculus may appear as a slight, grainy buildup that is barely noticeable. At this stage, the consequences of dental calculus may be limited to bad breath and mild gum inflammation. As dental calculus continues to accumulate, it may appear as a thicker, more noticeable layer on the teeth. The consequences of dental calculus at this stage may include increased gum inflammation, bleeding and sensitivity, as well as a higher risk of cavities and tooth decay. In advanced cases, dental calculus may appear as a thick, crusty layer that covers much of the tooth surface and extends below the gum line. The consequences of dental calculus at this stage can be severe and may include advanced gum disease, tooth decay, and tooth loss. Advanced gum disease can also increase the risk of other health problems, including heart disease and stroke. Interproximal cavities, also known as proximal or interdental cavities, are a type of dental cavity that forms between teeth where they come in contact with one another. Here's a brief explanation of what interproximal cavities are and how they form. Interproximal cavities are caused by the buildup of plaque and bacteria on the surface of the teeth. When teeth come in contact with one another, it can be difficult to clean the areas in between them, especially with just a regular toothbrush. Over time, this can lead to the buildup of plaque and bacteria in the spaces between the teeth, which can cause tooth decay and the formation of cavities. Interproximal cavities can be difficult to detect in their early stages because they may not cause any noticeable symptoms. However, as the cavities progress, you may begin to experience symptoms such as sensitivity to hot or cold temperatures, pain when biting or chewing, and visible dark spots or holes on the surface of the tooth. It is important to address interproximal cavities as soon as possible to prevent further damage to the teeth. Your dentist may use a variety of diagnostic tools to detect interproximal cavities, including visual exams, x-rays, and intraoral cameras. Treatment for interproximal cavities typically involves removing the decayed portion of the tooth and filling the cavity with a dental filling material such as composite resin or amalgam. Regular dental checkups and cleanings can help prevent interproximal cavities by identifying and removing plaque and bacteria buildup before it can cause tooth decay. Mild occlusal cavities are often reversible and can be treated with conservative dental interventions such as fluoride treatment, improved oral hygiene practices, and changes to the diet. These cavities may appear as small white spots or pits on the surface of the tooth and can usually be repaired with a dental filling. Moderate occlusal cavities are more advanced and may require more extensive dental treatment to repair. These cavities may appear as larger, deeper pits or holes on the surface of the tooth and may cause some discomfort or sensitivity. Treatment may involve a dental filling, a crown, or even a root canal if the cavity has progressed into the pulp of the tooth. Severe occlusal cavities are often associated with caries lesions that have progressed deep into the tooth and may cause significant pain and discomfort. These cavities may appear as large, deep holes or cracks in the tooth and may even cause the tooth to become structurally compromised. Treatment may involve a root canal, a crown, or even extraction of the affected tooth in severe cases. A broken cusp refers to the breakage or fracture of the pointed or elevated part of a tooth called a cusp. Here are some key points to explain broken cusps. A cusp is a pointed or elevated part of a tooth that helps the tooth perform its function, such as biting and chewing food. When a cusp breaks, it can cause pain, discomfort, and sensitivity, especially when biting or chewing. Broken cusps can be caused by a variety of factors, such as biting down on hard objects, tooth decay, large dental fillings, or trauma to the tooth. In some cases, cusps may also break due to natural wear and tear over time. Treatment for broken cusps will depend on the severity of the break and the extent of the damage. In mild cases, the tooth may be treated with a dental filling or bonding material to repair the broken cusp. However, if the break is more severe or extends into the pulp of the tooth, a root canal may be necessary to remove damaged tissue and restore the tooth's structure. In some cases, a dental crown may also be recommended to protect the tooth and prevent further damage. It is important to address broken cusps as soon as possible to prevent further damage to the tooth and surrounding tissues. Left untreated, broken cusps can lead to infection, decay, and even tooth loss. Regular dental checkups and cleanings can help identify and treat broken cusps in their early stages before they become more severe and require more extensive treatment. Amalgam fillings can cause stress lines or cracks in the tooth over time. If these cracks are small and do not extend into the tooth structure, they can be monitored and may not require treatment. However, if the cracks are larger and affecting the tooth's integrity, a dental crown may be necessary to protect the tooth and prevent further damage. Amalgam fillings can also cause fracture lines in the tooth, which can result in pain and discomfort when biting or chewing. Treatment may involve removing the filling and placing a new one, or if the fracture is more severe, a dental crown or root canal may be necessary. Amalgam fillings can sometimes become loose or develop gaps between the filling and the tooth, allowing bacteria to enter and cause decay. In these cases, the filling may need to be replaced to prevent further decay and infection. Amalgam fillings can also cause cusps and ridges of the tooth to break or wear down over time, resulting in pain and sensitivity. Treatment may involve repairing the damaged area with a dental filling or bonding material, or if the damage is more extensive, a dental crown or root canal may be necessary. There are several types of dental fractures, including enamel-only fractures, enamel dentin fractures, and root fractures. Treatment options will depend on the type, location, and severity of the fracture. Treatable fractures usually occur above the gum line and can often be treated with dental bonding, a dental crown, or other restorative treatments. Untreatable fractures usually occur below the gum line and may require extraction of the affected tooth or removal of the fractured portion of the tooth, depending on the severity of the fracture and the extent of the damage to the tooth. Teeth grinding, also known as bruxism, can cause enamel wear and flattening of the biting surface of the teeth. Dentists will look for signs of enamel wear, including smooth and shiny surfaces on the teeth, shortened teeth, and flattening of the biting surfaces. Teeth grinding can also cause cracks and fractures in the teeth, which can be seen during a dental examination. Dentists will look for signs of cracks or fractures in the teeth, which may appear as small lines or chips in the enamel. Chronic teeth grinding can cause gum recession or the pulling away of the gums from the teeth, exposing the sensitive tooth roots. Dentists will look for signs of gum recession, including gaps between the teeth and gums, and sensitivity to hot or cold temperatures. Teeth grinding can also cause pain and tenderness in the jaw muscles and joints, which dentists will look for during an examination. Patients may also experience headaches, earaches, and facial pain. The way the upper and lower teeth fit together, known as occlusion, is an important factor in bite stability. Dentists will check for proper alignment and positioning of the teeth, as well as any signs of malocclusion or misalignment of the teeth. Wear patterns on the teeth can also be an indicator of bite stability. Dentists will look for signs of uneven wear or damage to the teeth, which may be caused by bruxism or teeth grinding, malocclusion, or other factors. Proper muscle function is essential for bite stability. Dentists will evaluate the strength and function of the muscles used for chewing and speaking, as well as the function of the temporomandibular joint or TMJ, which connects the jawbone to the skull. The TMJ is a complex joint that can be prone to dysfunction and pain. Dentists will look for signs of TMJ disorders such as clicking or popping sounds, limited movement of the jaw, or pain in the jaw, neck, or ears. One of the most common signs of oral cancer is the presence of abnormal growth or sores in the mouth. Dentists will check for lumps, bumps, or rough spots on the gums, tongue, lips, or other areas of the mouth that don't go away after a few weeks. Changes in the color of oral tissues can also be a sign of oral cancer. Dentists will look for patches of white, red, or dark-colored tissue that appear different from the surrounding tissue. Oral cancer can cause pain or tenderness in the mouth, throat, or neck. Dentists will ask about any pain or discomfort that the patient may be experiencing and may palpate or feel the tissues to check for tenderness or swelling. Oral cancer can affect the function of the mouth, making it difficult to chew, swallow, or speak. Dentists will ask about any difficulties with these functions and may evaluate the patient's ability to chew and swallow. Oral cancer can spread to the lymph nodes in the neck, causing them to become swollen or tender. Dentists will palpate the neck lymph nodes to check for any abnormalities. These are the basic key points that we usually check during your examination. Just to recap, taking x-rays are an essential part of your dental exam as they can diagnose almost all dental issues that cannot be seen on a visual exam. Some of the most common x-rays we take are a panoramic and full mouth x-rays. We check your gum health and look for any signs of gingivitis and periodontal disease. We also check the tooth structure both internally and externally to look for signs of cavities, broken cusps or fillings, cracks and fractures, bite instability, and even oral cancer.
We thank you for your interest and time in giving importance to your oral health, and we look forward to see your awesome smile in your visit. And remember, prevention is always better than cure.